At Springs Medical, we recognise that alcohol consumption can be an enjoyable and safe pastime. We also recognise that excessive alcohol consumption can cause considerable problems. The National Health and Medical Research Council, their guidelines for people to consume no more than 2 standard drinks a day and to have 2 alcohol-free days per week, and at any one sitting not more than 5 standard drinks. This has changed of late. So previously for men it was 4 standard drinks a day, but now after researching health across the board, it's been determined that a safe amount to drink is 2 standard drinks a day. Generally, when addressing alcohol issues with people, some people of course drink considerably more than that, and some people drink close to the recommended amount. People generally fall into 2 camps with regard to alcohol consumption. We, as their health advisors, say to people, listen, it would be a good idea to adhere to the guidelines, particularly for the long term. We understand that at times people might drink more than that, but as a general habit, our recommendation would be to stick to the National Health and Medical Research Council guidelines. And most people, if you inform them of that because of the issues involved with excessive alcohol consumption, they can reduce their alcohol consumption to safe amounts. Now, there are techniques and advice that we can give to do that. You know, maybe we'd say to people, drink a lower strength alcohol, maybe they drink later in the day, maybe they say that they would always have Monday and Tuesday where they don't drink. So the majority of people with some simple advice can reduce their alcohol and thus, don't run into any problems with their alcohol consumption. There are, however, people who find it very difficult to reduce their alcohol consumption, and that may be because it's been habit forming over many years, or in fact they might be physically dependent on the alcohol and they may suffer some withdrawal symptoms from alcohol, be they psychological or more of a physical nature. So when addressing the issue, we as GPs, we find it, we need to know about alcohol consumption. It's integral to our moving forward with good health advice. So generally we like to get down to I like to get down to tin tacks, and it's about how many standard drinks a day, the type of alcohol you drink, the frequency that you drink, whether it's every day or not, and is it possible for you to change that? So it really depends where a person is at. Sometimes an example would be someone who comes into the clinic, they hear that I have an interest in people with alcohol problems, and they often will be drinking far more than they want. And again, it depends on how many standard drinks a day, and that may vary from 10 standard drinks up to 40 standard drinks a day. Hard to believe, but yes, people can drink that amount of alcohol. Then it really depends on the history. Have they tried to stop before? What happens when they do? Are they going to need some external help? There's all sorts of strategies we involve. We work with the Community Health Centre in Dalesford. There's a drug and alcohol counsellor over there. Sometimes the reason for the alcohol consumption is to do with psychological problems, so sometimes addressing mental health issues, be it a referral to a psychologist or be it medication for depression, can be a useful first step. But it's one of those issues that if people are consuming a large amount of alcohol to try and address other issues in their life, be it relationship problems, be it high blood pressure, be it stomach problems, be it anxiety disorder, those other issues aren't able to be addressed until the alcohol issue is addressed. So sometimes it's a really good first step to come in, speak to your GP. All of us at Springs Medical are able to make a good assessment, a history, an examination. We might order some tests to see if it has affected your health, be it liver tests or ultrasounds, and then come up with a formulation plan. We might refer to some of our colleagues within the practice, involve psychologists and drug and alcohol counsellors, and then get to know the person and to try and work together with their families and partners in how we're going to best address the situation. And most of the time, if people have the will to change, there's good help available, and hopefully we can help.